Thank you, First Lady Erdogan. Good morning, esteemed members of the United Nations, honorable guests, and respected representatives. My name is Harvey Whiteford, Director of the Queensland Centre for Mental Health Research in Australia. I have been called upon today to speak at this hearing about the haunting psychological impacts of the Syrian refugee crisis. Now in its 14th year, 2023 was among the worst for the Syrian crisis, as a number of problems came together to endanger lives. 16.7 million people nationwide need humanitarian assistance as a result of the situation's unprecedented escalation. Research indicates that exposure to violence and displacement can cause pre-existing mental disorders to worsen widely and can also lead to the emergence of new disorders. I myself have conducted epidemiological research with a few of my colleagues, Dr. Fiona Charleson, Dr. Sandra Diminik, and Dr. Young Yi Lee, on mental health of Syrian refugees. Epidemiological models are commonly employed to determine the prevalence of diseases within a population. Nevertheless, these approximations can have broader and more realistic effects, such as providing guidance for the focused expansion and enhancement of mental health services. Together, we investigated possible uses for the Syrian population affected by the conflict. As inputs for further estimation, we can use prevalence to estimate major depression and post-traumatic stress disorder in populations affected by conflict. To calculate the number of years that Syrian populations have lived with a disability, YLD, depression, or PTSD, we employ the Global Burden of Disease methodology, or GBD. Here's what research has found. Research has estimated 2.2 million cases of PTSD and 1.1 million cases of depression. As a result of war and PTSD, lack of employment, poor daily activities, and inadequate living circumstances have been reported among refugees. An age-standardized depression rate of 13.4 years living with disease per 1,000 Syrian population is estimated. Now to center in on the women and children affected by the refugee crisis. According to a survey of a caregiver report from northern Syria's refugee camps, almost half of the displaced children show signs of emotional and behavioral disorders. In some other research, a school-based study in Damascus and Latakia reported high rates of PTSD, 35%, depression, 32%, and anxiety, 29%. Now to move on to the women. Women have been found to be at increased risk of a number of vulnerabilities, including depressive symptoms, according to research conducted in 2019. An underlying theory explaining these higher rates of depressive symptoms in women and girls in conflict environments is that experiences of gender-based violence, or GBV, are frequently linked to mental health issues, including intimate partner violence, IPV, and non-partner sexual violence. Daily experiences with IPV may be especially harmful because in non-emergency situations, IPV has been reportedly associated with poor physical and mental health outcomes. To finish, I would like to speak on the lack of mental health care inside of the country. A major contributor to the public health emergency in Syria is service scarcity due to damaged healthcare infrastructure, including mental health services. Though the ongoing difficulties are difficult to overstate, efforts have been made to rebuild and strengthen the severely weakened healthcare system. half of all medical professionals still live outside the nation, and only 48% of public hospitals and 48% of private hospitals are fully operational. I urge the United Nations to assist in the aid of those whose mental health has been affected during this crisis. The UN's very own United Nations High Commissioner of Refugees is an organization the rest of the United Nations should work with to ensure that refugees are receiving proper mental health services. The UNHCR's primary method of delivering mental health services is through community outreach volunteers. These volunteers are trained to identify individuals in need of mental health and psychological support services and safely refer them for appropriate services and provide necessary follow-ups. I will now introduce the Syrian representative, Miriam Jalabi.